EMS and the fire department are there to provide medical aid, but they're not allowed to enter the scene until the threat is cleared. Did you know that you can bleed out in 2 to 4 minutes from certain injuries? I'm Greg Freshour. As a U.S. Army combat medic for nearly 30 years and a tactical SWAT medic for 17, I have seen how simple, basic medical training for average citizens can mean the difference between life and death. In this module, we're going to empower you with some simple medical training to save your life and the lives around you. Yes, today we are focusing on injuries as a result of an active shooter, but understand, it's far more likely you'll use these skills to treat an accident victim. My point is this: what you do in the first few minutes will absolutely mean the difference between life and death. Law enforcement will be there to stop the shooting and contain the situation. EMS and the fire department are there to provide medical aid, but more than likely they will not enter the scene until the threat is clear. This means that it will be up to you to save the lives of those that are injured. In 1897, a highly respected military surgeon named Colonel Sin made this statement: "The fate of the wounded rests with the one who applies the first dressing." This is still true today, and especially in situations where there may be many injuries. You have the ability to save a life or even your own. There are 3 categories of injuries: injuries that someone will die from regardless of what we do for them, injuries that someone will not die from regardless of what we do for them, and then those in the middle. These are the injuries that you can absolutely make a difference whether a person lives or dies. This third group is who we need to focus on. We are going to target bleeding control and breathing. Let's look at bleeding first. There's capillary bleeding, there's venous bleeding, and there's arterial bleeding. With capillary bleeding, the blood loss will be slow and there will be an even flow. It will be bright red in color. This is similar to what you might see when someone skins their knee. This is usually not serious bleeding, and the bleeding will eventually stop on its own. Venous bleeding is a steady, slow flow. It's usually dark red in color. And we probably need to treat someone with venous bleeding pretty quickly. And then arterial bleeding is the bright red spurting blood, and there's a pulsating flow. If someone has arterial bleeding, you absolutely have to do something about this. The bleeding will not stop on its own until the heart stops. In a stressful life or death moment, it will not be important that you can identify exactly what type of bleeding you are experiencing. It will only be important that you control or stop the bleeding to increase the odds of survival. We start with tourniquets. Tourniquets are just a constricting band that applies circumferential pressure and cuts off blood flow. They go on the extremities only, so either the arms or the legs, nowhere else. They can be self-applied, or you can apply one to someone else. In the past, people were afraid to use tourniquets because they thought you'd end up losing that limb. It's just not true. We have thousands of documented uses of tourniquets with no further neurological damage to the limb. Here's how you apply a tourniquet. Place the tourniquet as high up on the arm or leg as it will go so that you know all injuries are included. Pull the Velcro as tight as you can around the arm or leg, then turn the windlass rod until the bleeding stops. This is going to hurt. Secure the windlass rod and pull the time strap over. If you're applying the tourniquet to someone else, it's a good idea to talk to them while you're doing this. Let them know it's going to hurt and that you're there to help them. The tourniquet is tight enough when they no longer have a pulse in the arm or leg and the bleeding has stopped. We recommend keeping these tourniquets around your office. But if you don't have one or you can't get to it, you can make a tourniquet out of other items. You need a strap and a rod. Think about an electrical cord and a chair leg, or a cloth belt and a sturdy pin. Any tourniquet that you apply, whether it's one of these or one that you've made, needs to be left alone after it's been applied. Don't release it to check the bleeding. Once EMS arrives, they will check the tourniquet and may adjust it, but they will leave it on until they get to the hospital. The only person that will take the tourniquet off will be the doctor or surgeon at the hospital once they're ready to treat the injury. When injuries are less severe or when a tourniquet cannot reach the injured area, we can apply direct pressure and pressure dressings. Here's how. You will place the bandage over the wound and then wrap the bandage around the injury, covering the entire injury. Wrap the pressure dressing as tight as you can. Just like with a tourniquet, you can use an actual pressure dressing like we used here, or you can use what you have available. A pant leg, a shirt sleeve, part of a curtain, anything you can use to wrap and put pressure on the injury. Once you've applied a pressure dressing, do not release the pressure to check on the wound or to show anyone else. It stays on until the injured is at the hospital with a doctor. If the bleeding doesn't stop, you may need to place a tourniquet above the pressure dressing. And the last way to manage blood loss that we're going to talk about is wound packing. Wound packing is for areas where we can't get a tourniquet. That's the buttocks, the pelvic girdle, and high on the shoulders, both front and back. With wound packing, basically we're packing material into the wound cavity to stop the bleeding. A bullet causes massive internal injuries that we cannot see from the outside. So we have to fill the void that the bullet caused with gauze or any other fabric to stop the bleeding inside that wound. If we just apply pressure from the outside, the bleeding from inside that cavity will not stop. Here's how. Using sterile gauze if you've got it, or any other fabric, a t-shirt, tablecloth, or curtains, fill the wound. Start with a clump and then continue to pack in all directions until each part of the cavity is filled. Gunshots cause more internal damage than we can see, so you might be using more gauze or fabric than you expected, but just keep filling the empty space. Then apply pressure from the outside of the wound until the bleeding is stopped. Sometimes people ask, if I'm using a t-shirt or some other non-sterile material, is there a risk of infection? Sure, but right now they're bleeding to death. We have to stop the bleeding first. They will get antibiotics at the hospital, but the goal here is to slow or stop the bleeding so they can survive. This is another time when we have to hurt someone to help them. Wound packing is going to hurt. All right, so we've talked about options you can use to help someone who's bleeding. What about helping someone who's struggling to breathe? Let's talk first about a sucking chest wound. This is a penetrating injury to the chest that is large enough that air can move in and out of the chest instead of in and out of the trachea. If this goes on long enough, the lung will collapse. So how do we fix this? The goal here is to seal the wound. You can do that by simply using a chest seal. Place the chest seal directly over the wound. When treating a chest wound, assume if there's an entrance wound, there will also be an exit wound. If there's an exit wound, that will also need to be sealed the same way that we did the entrance wound. If you don't have a chest seal nearby, cellophane, a trash bag, a Ziploc baggie can all be used for a short-term fix. Anything that does not allow air to pass through will work. If you've been helping someone and have to leave them for some reason, maybe because the shooter is coming back or because you have to clear out, roll them into the rescue position. The rescue position allows them to continue breathing by keeping their airway open. So this wraps up the basic life-saving medical training. The immediate actions you take will mean the difference between life and death, both for yourself and for those around you.